Well, right now there are some new concerns about the measles tonight in our neck of the woods. Cases are simply popping up across the country, including some right here in western New York. And health officials say this should not be happening. And as 2 on your side's Claudine Ewing explains for us, a big part of that concern is about vaccinations.
There's an isolated cluster of young people with measles in Rochester. It turns out their parents chose not to have them vaccinated.
As long as we have unimmunized population in the United States, we are at risk.
Health Commissioner Dr. Gail Burstein recalls the measles case in Erie County at the end of last year. Some parents are opting out of immunizing their children for medical concerns or religious beliefs.
The number of religious exemptions has increased rapidly over the last 5 to 10 years. We have to ask ourselves, has religion changed that rapidly in the last 5 or 10 years?
Doctors don't want to see a health crisis like we saw at Disney in California.
The state of California took away personal belief out of their law for not getting vaccines.
And there is a push to remove the religious exemption in New York State.
I would hope that eventually the only reason for people choosing not to get immunized is because of medical contraindication. Because it's really not just about the individual, it's really about the whole community.
17 states allow some type of non-medical exemption for measles inoculations due to personal beliefs. 30 states allow religious exemptions.
I, as a parent, would not want my children sitting next to somebody at school who is not immunized.
While nothing is 100%, Dr. Burstein says the measles vaccine is very effective. After one dose, it's 93% effective. State lawmakers introduced legislation in New York that would repeal all non-medical exemptions for vaccines in the state. Legitimate reasons also include allergies and medical reasons. Claudine Ewing, Channel 2 News.